So the first thing I wanted to talk about is evaluation. And evaluation of dental care always occurs at well-child visits without fail. I've incorporated it in all of my evaluation forms. I have checks to prompt me and promote me to talk about toothbrushing and fluoride and water sources and pacifier use and all of those things. So I can say that I never forget talking about dental care during well-child visits. I try now, with all that we know, to incorporate it into every sick visit. When a child comes in and I suspect pharyngitis, and I'm already in the mouth anyway, I'm looking to see if there's evidence of tooth decay. And surprisingly, I find it a fair amount, and I'm able to do referrals. I also try to incorporate it into my care in the newborn nursery. If I see evidence that the parents have poor dental care, poor teeth, I begin talking about it right then and there. Recently, we hired a new pediatrician. She said, I'm just not comfortable telling parents that, I see that they have bad teeth. I don't feel that way anymore. It's not like they don't know. They have mirrors. They look in them. They know that their teeth are in poor repair. And when I begin talking with them about this, they're like relieved. They say, thank you, for bringing this up. I don't want my children to look like this. And all of a sudden, I'm a hero because I can say, I can make sure, or I can help you to make sure that this is not going to happen to your children. So the next thing I want to talk about is fluoride recommendations and how I handle this. If I see that there's a moderate risk for dental decay in the family, I do recommend fluoride. And this is how I do it. I decide if it's a bottle-fed baby, a breastfed baby, and what the water source is. So first I'm going to talk about a family that I've been seeing, and the baby is exclusively breastfed. For the most part, those children get no water except for what they get in the breast milk. So at 6 months of age, I add fluoride drops to these babies. Already we give vitamin D drops to all exclusively breastfed babies. It's become a policy for the American Academy of Pediatrics for many years. It used to be that you'd go to the store and you'd buy a multivitamin over the counter and you give 1 dropper full a day. Now they actually just have vitamin D that's available, so we don't have to give the whole multivitamin. But nonetheless, these mothers are used to giving a vitamin every day to their breastfed baby. So at 6 months, I changed that to a multivitamin with fluoride. And I asked them to continue giving 1 dropper of this a day as long as they are breastfeeding. Now, if they stop breastfeeding or they are giving a fair amount of bottle, once they start bottle feeding, and I can't anymore qualify how much is water they're getting from adding water to formula versus breastfeeding, I tell them to stop doing that because I don't want fluorosis. And I tell them to call me so that I can talk to them about how they should be giving fluoride. So that takes me to the bottle-fed baby. For the bottle-fed baby, I ask them where they get their water source. And for us in Livingston County, there are many answers to this question. Their water source could be city. That's the easy one. I say, beautiful. This is great water. If you're going to use city water, it is fluoridated, and we're done with our discussion. The second choice for us is community well. We have a lot of communities that are serviced by community wells. I need to know if that water is fluoridated. I can't make an assumption that it is. They can go back and check their water reports that they receive. They can make a phone call to find out if the water that comes in that community well is fluoridated, or they can test the water like we do for well waters. If we find out the community well is fluoridated, again, that's beautiful, and we go with that. A lot of water in Livingston County comes from wells. And this water, I ask them to test. I personally give them a water test kit, and I tell them how to complete the form, to insert a check, where to send it, and when it comes back, I ask them to call me, and they can read off of that form the content of fluoride that's in there, or to bring it back at the next visit. Many people choose not to drink the well water in Livingston County, even though it tastes fine, and they choose to buy bottled water. If they're going to use bottled water, I need them to understand that they have to use bottled water that's fluoridated, and people don't understand that. Every bottled water is not fluoridated. I have gone to all the supermarkets in our area, and I know which fluoridated waters are available, so I can direct them. If you fill up the spigot, that's not fluoridated, I tell them. And the other thing I talk about is if they have reverse osmosis, they're using their well and they have reverse osmosis, they're essentially drawing all of their fluoride out. So really, we need to come up with another source. I rarely, except for that infant, write for fluoride drops. I usually refer them to either testing to make sure there's fluoride in the well, or most of the time I refer them to buying bottled water. I start talking to them about their water source at the 2-4 month visit. So by the 6 month visit, I hope they've defined their source of water, what they plan to use. If they haven't tested their water, and I've given them a water test kit on multiple occasions, by 6 months, they're just simply not going to do it. And I encourage them to buy bottled water with fluoride. So when do I refer? Most of my referral time, unless it's an emergent need, comes at my 9-month visit for babies. If they come to me and they're new to the practice, but they're not an infant, I'll come back to that. But if I've been seeing them all along, I start my big thrust for a referral at 9 months. And I usually ask them if they have a family dentist already in the community. If they do, I want to go over how we've established a dental home in a minute, but I check to see if that dentist sees children. And if they do, I keep all of the family together with that dentist. I guess I'll jump forward. We actually, Dr. Carrico and Dr. Hale for our community has formulated a very nice list set up by cities. And on that, I can look, by, for example, Brighton. I'm going to go forward here a second. This is a list for Livingston County dentists, and this is just the first page of it, and this is a Brighton dentist. So I say to the family, do you have a dentist for your family? And they say yes, and I go to the city that they live in, and I quickly reference whether that dentist is comfortable seeing infants or children. I can also take that list and tell you if they will see Medicaid patients. So already, right from the get-go, before they leave, I'm comfortable that they have found a dental home that's good for them. If I can't find that dentist on this list, I don't erase them and say, okay, this isn't going to happen, you got to find another dentist. But they need to go back and call their dentist and find out if that dentist is comfortable seeing infants or children. I can tell you this is a barrier for me because every dentist has not wrapped their arms around this concept of a dental home by a year. Many still in our county have not. And so they'll come back and they say, oh no, my dentist said 3 or 4, or just bring him and let him watch for a while. And I say, that just doesn't work anymore. That's really not what we're teaching. And then I help them find a dentist off of this list. I used to just refer everybody to Dr. Hale and Carrico, but as Kevin shared with you earlier, that they're overwhelmed and that process no longer works. I think I did that mostly because we didn't have the number of dentists available that would see Medicaid patients. In my particular practice, I have 30% Medicaid. So I really needed to work on finding a dental home for these patients. For kids that are brand new to the community, that I haven't been seeing as babies, as soon as they come to me for the first time, whether it's a sick visit or a well visit, now they found a medical home, I rate then make sure that they also simultaneously have found a dental home. I'm not waiting until they have a problem or until they come in for a well child visit, because that could be some time. So when the families come in, I say, I'm glad you're here. Have you been able to find a dentist for yourself in the community? I do the same thing for the adults. Have you been able to find yourself a physician in the community? So now I've got the whole family settled for their medical needs. For us, this has worked fabulous. I no longer have difficulty finding homes for my patients. It's quick, it's easy. I have the list in every single room. I have empty blank little note cards there. I can quickly jot down addresses and phone numbers for these people. So referral for me is no longer a problem. The whole point of light concept has worked beautifully.